Hey guys, welcome to Medifaction. Today we will learn about the physiology of dialysis and artificial kidney. Dialysis is a treatment that filters and purifies the blood using a machine. This helps keep your fluid and electrolytes in balance when the kidneys can't do their job. So, to learn more about dialysis, let's start learning. In this video, I will be enumerating an introduction. We will talk about artificial kidney, mechanism of function of artificial kidney, frequency and duration of dialysis. We will talk about dialysate. We will also discuss about peritoneal dialysis, uremia, and some complications of dialysis. Dialysis is the procedure to remove waste materials and toxic substances and to restore normal volume and composition of body fluid in severe renal failure. It is also called hemodialysis. This is the machine used for dialysis. Artificial kidney. So, artificial kidney is the machine that is used to carry out dialysis during renal failure. It is used to treat the patient suffering from acute renal failure and also chronic or permanent renal failure. Mechanism of function of artificial kidney. The term dialysis refers to diffusion of solutes from an area of higher concentration to the area of lower concentration through a semi-permeable membrane. This forms the principle of artificial kidney. Patient's arterial blood is passed continuously or intermittently through the artificial kidney and then back to the body through the vein. Heparin is used as an anticoagulant while passing the blood through the machine. Inside the artificial kidney, the blood passes through a dialyzer called hemofilter, as you can see one right here, which contains minute channels interposed between two cellophane membranes, which are porous in nature. The outer surface of these membranes is bathed in dialysing fluid called dialysate, which when used is constantly replaced. Urea, creatinine, phosphate, and other unwanted substances from the blood pass into the dialysate by concentration gradient. The essential substances required by the body diffuse from dialysate into blood. Almost all the substances except plasma proteins are exchanged between the blood and the dialysate through the cellophane membrane. In addition to the dialyzer, the dialysis machine has several blood pumps with pressure monitors which enable easy flow of blood from the patient to the machine and back to the patient. Total amount of blood in the dialysis machine at a time is about 500 milliliters. The rate of blood flow through the dialysis machine is about 200 to 300 milliliters per minute. The rate of dialysate flow is about 500 milliliter per minute. Frequency and duration of dialysis. The frequency and duration of dialysis depends upon the severity of renal dysfunction. Dialysis is done usually thrice a week in severe uremia. Each time, the artificial kidney is used for about 6 hours. With the help of this picture, we can easily identify the procedure. So, from the patient, blood is drawn and it is now stored in the dialyzer machine, and now here we can appreciate semi-permeable membrane, and the used dialysate with the waste products gets stored in this container, whereas the fresh dialysate is simultaneously passed in. And after that, with the help of this semi-permeable membrane, the clean blood is again passed into or returned into the patient's body. This is how it works. Now let's talk about the dialysate. The concentration of various substances in the dialysate is adjusted in accordance with needs of the patient's body. The fluid does not contain urea, urates, sulfate, phosphate or creatinine, so that these substances move from the blood to the dialysate. The fluid has low concentration of sodium, potassium and chloride ions than the uremic blood. But the concentration of glucose, bicarbonate and calcium ions is more in the dialysate than in the uremic blood. Now let's learn about peritoneal dialysis. Peritoneal dialysis is the technique in which peritoneal membrane is used as a semi-permeable membrane. It is also used to treat the patients suffering from renal failure. Here, a catheter, as you can see in this diagram, a catheter is inserted into the peritoneal cavity through anterior abdominal wall and sutured. The dialysate is passed through this catheter under gravity. The required electrolytes from dialysate pass through vascular peritoneum into blood vessels of abdominal cavity. Urea, creatinine, phosphate and other unwanted substances diffuse from blood vessels into the dialysate. Later, dialysate is drained from peritoneal cavity by gravity. Peritoneal dialysis is a simple, convenient and also a less expensive technique compared to hemodialysis. Patients themselves can change the fluid on an outpatient basis. However, it has few drawbacks. It is less efficient in removing some of the toxic substances and it may also lead to complications by infection. Uremia. Blood level of urea, nitrogen and creatinine increases during uremia. Toxic substances such as organic acids and phenols also accumulate in blood. Artificial kidney can excrete more than double the amount of urea that could be excreted by both the normal kidneys. About 200 to 250 milliliter of plasma could be cleared of urea per minute by the artificial kidney. But the urea clearance by normal kidney is only about 70 milliliter per minute. Complications of dialysis. Complications of dialysis depend upon patient's condition, age, existence of diseases other than renal failure and many other factors. Common complications of dialysis in individuals having only renal dysfunction are sleep disorders, anxiety and also depression. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.